Common peroneal nerve. It is one of the branch of the sacral plexus, or one of the component of the sacral plexus. Root value. It is formed by the dorsal division of anterior primary rami of L4, L5, S1 and S2 spinal nerves. The common peroneal nerve near the neck of the fibula divides into two branches, deep peroneal nerve and superficial peroneal nerve. Deep peroneal nerve, it is the chief nerve of anterior compartment of leg. It is one of the division of or branch of common peroneal nerve. Course and relations. It arises from the common peroneal nerve near the neck of the fibula. That is the first point. It enters the leg, anterior compartment of leg, by piercing the anterior intermuscular septum. See, this is the line which represents the anterior intermuscular septum. So it enters the anterior compartment of the leg by piercing the anterior intermuscular septum in the leg. Okay. It enters the leg by piercing the extensor digitorum longus. By piercing the extensor digitorum longus and runs between the extensor digitorum longus and the tibialis anterior, where it runs along with the course of the anterior tibial artery. So in the upper one third of the leg, the nerve is lateral to the anterior tibial artery. In the middle one third of the leg, the nerve is anterior to the anterior tibial artery. In the lower one third of the leg, the nerve is lateral to the anterior tibial artery. So the nerve is first lies lateral to the artery, then anterior to the artery, again lateral to the artery. Instead of crossing to the medial side, the nerve hesitates to cross to the medial side, and it once again comes to the lateral relation of the artery. So the nerve is also known as nervus hesitans. Near the ankle joint, the nerve ends by dividing into two branches, medial and lateral branches. Branches and distribution. It gives muscular branches to tibialis anterior, extensor digitorum longus, extensor hallucis longus and peroneus tertius. The lateral terminal branch gives an articular branch to ankle joint. Then it runs deep to the extensor digitorum brevis, where it forms a pseudoganglion. From the pseudoganglion, the lateral branch gives muscular branch to extensor digitorum brevis, and it also supplies the tarsal joint and metatarsophalangeal joint of second, third and fourth toes. The medial branch gives muscular branch to first dorsal interosseous. Then it continues as the cutaneous branch, where it ends by supplying the first interdigital cleft, that is the cleft between the great toe and the second toe. So this is the area which is supplied by the deep peroneal nerve. Applied anatomy. Injury to deep peroneal nerve results in paralysis of the anterior compartment muscles of the leg. So this results in loss of dorsiflexion of the foot. Dorsiflexion of the foot. And this condition is known as foot drop. Since the extensor digitorum longus and extensor hallucis longus are paralyzed, the toes are not able to extend. We cannot extend the toes. So there is loss of extension of toes.